My name is EC. That's what my friends call me. I'm an electronic cigarette. I was assembled and brought to life in a factory somewhere in China. I have a battery pack, a heating element called an atomizer, a cartridge tank where I store my flavored electronic juice, and a light. I went on a journey one day to a store in California. After a few days, I found a new friend named Dax. We spent a lot of time together. He took me everywhere with him. I was there through the good and bad times. I was there during stressful times for school projects and college applications. I was also there to hang out with friends at homecoming. But one day, Dax got really sick. He kept coughing and wheezing. I heard he had popcorn lung. This is a condition where a chemical called diacetyl damages and blocks his airways. It got so bad he needed a lung transplant, but it was too late. I was abandoned just collecting dust on a shelf. But one day, Dax's girlfriend found me and looked at me with anger and resentment. "It's all your fault," she yelled at me. She grabbed me and threw me in the trash. I now realize it is partially my fault for Dax's death. The chemical that damaged his lungs is found in the juice I contain. I didn't realize I was so harmful. Be knowledgeable. Share this information. It could save you or your friends. If you or someone you know need help quitting their use of e-cigarettes or tobacco, call 1-800-QUIT-NOW.
5 people have died from vaping-related lung disease as the number of total cases in the U.S. tops 450. How much more damage will be done before vaping is prevented? Joining us in studio is Dr. Mona Hacker to discuss the impact of this latest addiction. Thank you so much for joining us.
Thank you for having me.
And I know that we've talked about this before. We're both moms, so we know that it's a big deal with teens right now. And I heard recently, actually this morning, that Michael Bloomberg is donating $160 million to banning e-cigarettes and the sweet smell. And why do you think it's so prevalent with teens?
Well, I think it's become an epidemic. It's a crisis in the country, I think, right now. And I think the reason that teens are especially susceptible is because of the marketing that was taking place. Now, I know the FDA is starting to come down on some of that marketing, but with e-cigarettes, and there's many different kinds of e-cigarettes, I'll start with that, but Juul has the biggest market share. With their sleek design, looking like a flash drive, it's discreet, it's sleek, it's easy, it's accessible to teens. On top of which, they were marketing with all these flavors, and these flavors like bubblegum and Tutti Frutti, which of course, again, are attracting those young adults, middle schoolers, high schoolers. And once they get started, we know that nicotine is one of the most addictive substances out there. And children and young adults are even more vulnerable to this addiction.
For people that might not understand, juuling versus vaping, I mean, all these terminology that's out that we're hearing every day, but tell us the difference.
Absolutely. So I think the most important thing for parents and for all of us is to become educated about this because it's becoming so prevalent, unfortunately. So e-cigarettes are any type of battery-operated device where you basically have a liquid inside that can contain either nicotine or sometimes THC, which is the active ingredient which causes the high in marijuana, and then a bunch of other chemicals. You're vaporizing these chemicals and the nicotine and inhaling it. We talk about juuling because Juul has the biggest market share, and so it's thus become this verb. But you're vaping when you use a Juul as well. So vaping is just the act of using an e-cigarette of any kind.
Do you think people are shocked that, we've had deaths?
Absolutely, because ironically, e-cigarettes came out as a safer alternative to smoking. And thus, I think people took that as this is safe. And I'm often asked, is this safe? Absolutely, it is not safe. And we know even more so now how unsafe it is. But there's plenty of things we still don't know because those chemicals in that liquid that's in there have many different components, which can be, when heated up, can be dangerous. Some of those ingredients, you might read them and say, oh, that's not dangerous, that's not dangerous. Yes, if you ingest it, it may not be, but when you make it a vapor and it's going down into your pulmonary tree, that can become very dangerous, and thus we're seeing, and now I can even tell people it's actually deadly, because now we've had those 5 deaths and hundreds of people hospitalized with this respiratory illness. So there's a lot of different factors when we're thinking about the dangers of vaping.
what do you tell parents? I mean, what's the best thing that we can do for our kids? I mean, obviously we tell them this is bad, people are dying, but I mean, what's some real sound advice?
So exactly, it's hard to just tell our kids this is bad, don't do it. They may listen to that, but that's not the best way to have the conversation. I usually counsel parents to try to make it a more natural conversation, like you're driving by a sign that has something about e-cigarettes, or you hear a story or something's on the news. That's when you bring it up sort of naturally, have a conversation. When you expose yourself, your brain gets connected in a different way. And I think kids, they don't want to have memory loss, they don't want to have concentration problems, and they also don't want to give up control. And when you tell them how they're more susceptible to becoming addicted, they don't want anything to control them, whether it's us or that. So, you know, there's just different ways, and everyone knows their own children and what might work, but definitely the conversation and being there and watching them and knowing what's going on is key.
Exactly, like what we're doing. And I know that you do a lot of local news programming as well down in San Diego. And, you know, this is something that you're passionate about, you know, getting it out there and also being a mom. So I just appreciate you being on our show.
Oh, thank you.
And obviously any more information, they can go to our website as well. So thank you so much.
Thank you.